What happens to our bodies after the age of 80? A comprehensive guide to physical and emotional transformation in later life. Reaching the age of 80 is a profound milestone, a testament to resilience, endurance, and the quiet strength that comes with a life fully lived. Yet, as more people live into their ninth decade and beyond, a growing number of families, caregivers, and individuals themselves are asking a crucial question. What really happens to our bodies after the age of 80? While this topic is often avoided in conversation, it deserves thoughtful attention. Understanding the natural transformations that occur during this stage of life is not about dwelling on decline. It's about empowerment, preparation, and honoring the body's journey with compassion and wisdom. This guide explores the major physiological and emotional changes that commonly occur after the age of 80. Rather than presenting these shifts as limitations, we will reframe them as opportunities for adaptation, growth, and deeper self-awareness. By recognizing what is happening within the body and mind, individuals and their loved ones can make informed decisions that support health, independence, and quality of life. We will examine 5 key areas of change: sleep patterns, bone density, digestive function, joint and bone strength, and overall metabolic and digestive efficiency. Each section will provide a detailed explanation of the biological processes involved, real-life examples of how people navigate these changes, practical strategies for adaptation, and insights into the emotional and psychological dimensions of aging. By the end, you'll have a holistic understanding of what it means to live well beyond 80, not in spite of aging, but in harmony with it. 1. Changes in sleep patterns, rhythms of rest and renewal. One of the most noticeable and often misunderstood changes after the age of 80 is the transformation of sleep. Many older adults report that their sleep feels different, lighter, more fragmented, and occurring at different times than it did in earlier decades. Where once they might have slept soundly from 10 p.m. to 6 a.m., they now find themselves drifting off as early as 7 or 8 p.m. and waking up between 3 and 5 a.m., sometimes well before sunrise. This shift is not a sign of poor health or a disorder, but rather a natural evolution of the body's internal clock, known as the circadian rhythm. The circadian rhythm governs not only sleep, but also hormone release, body temperature, and other vital functions. As we age, the suprachiasmatic nucleus, the brain's master clock located in the hypothalamus, becomes less responsive to external cues like light and darkness. This reduced sensitivity leads to earlier melatonin release, the hormone responsible for signaling sleepiness. Melatonin production itself declines with age. In younger adults, melatonin levels rise sharply in the evening, peak during the night, and drop off by morning. However, in individuals over 80, this peak is often lower and occurs earlier in the evening. This explains why many seniors feel drowsy early in the night and wake up feeling alert before dawn, even if they haven't had a full 8 hours of rest. Another factor contributing to altered sleep is a reduction in deep sleep or slow-wave sleep. This stage of sleep is critical for physical restoration, memory consolidation, and immune function. With age, the brain spends less time in deep sleep and more time in lighter stages, making sleep more easily disrupted by noise, temperature changes, or even internal bodily processes like the need to urinate. It's also common for older adults to experience more frequent awakenings throughout the night. This can be due to a combination of factors, including medical conditions such as arthritis, heart disease, or chronic pain, medications that affect sleep, or even psychological stress and anxiety. Additionally, the bladder may become less efficient at holding urine overnight, leading to nocturia, the need to wake up multiple times to use a bathroom. Despite these changes, it's important to understand that the total amount of sleep needed does not significantly decrease with age. Most adults, regardless of age, still require between 7 and 9 hours of sleep per night for optimal functioning. The difference lies in how that sleep is distributed. Many seniors adapt by incorporating naps during the day or accepting a biphasic sleep pattern, sleeping in 2 segments rather than one long stretch. Consider the story of Margaret, an 83-year-old retired teacher who once prided herself on her ability to sleep through the night. Over the past few years, she noticed that she would fall asleep around 8 p.m. and wake up at 4 a.m., unable to return to sleep. At first, she felt frustrated and worried that something was wrong. But after speaking with her doctor and learning about age-related sleep changes, she began to reframe her experience. Margaret started creating a calming bedtime routine. She would dim the lights an hour before bed, read a gentle novel, and drink a warm cup of caffeine-free herbal tea. She also began practicing mindfulness meditation to quiet her mind. On mornings when she woke up early, instead of lying in bed feeling anxious, she would get up, make a cup of tea, and sit by the window watching the sunrise. She found that this quiet time brought her peace and even a sense of renewal. Margaret's experience highlights a powerful truth. While we cannot control all aspects of aging, we can influence how we respond to it. Small, consistent habits can significantly improve sleep quality and overall well-being. These include maintaining a regular sleep schedule, even on weekends, creating a sleep-friendly environment, cool, dark, and quiet, limiting screen exposure before bed, as blue light from phones and tablets can suppress melatonin, engaging in daytime physical activity, such as walking or stretching, which promotes better nighttime rest, avoiding large meals, caffeine, and alcohol close to bedtime, staying hydrated during the day, but reducing fluid intake in the evening to minimize nighttime bathroom trips. It's also worth noting that poor sleep doesn't just affect energy levels. It has far-reaching consequences for cognitive function, mood, and physical health. Chronic sleep disruption has been linked to increased risk of depression, memory problems, weakened immunity, and even cardiovascular disease. Therefore, prioritizing sleep hygiene is not a luxury. It's a vital component of healthy aging. For those who continue to struggle with sleep despite good habits, consulting a healthcare provider is essential. Sometimes, underlying conditions such as sleep apnea, restless leg syndrome, or medication side effects may be contributing factors. With proper diagnosis and treatment, many sleep issues can be effectively managed. Ultimately, the shift in sleep patterns after 80 is not a loss, but transition, one that invites a gentler, more intuitive relationship with rest. By listening to the body's signals and adapting with kindness, older adults can still wake up feeling refreshed, centered, and ready to embrace each new day. 2. Bone density changes, strength, stability, and support. Another significant transformation that occurs after the age of 80 is the gradual decline in bone density. Bones, which once provided a strong and resilient framework for movement and protection, begin to lose mass and strength over time. This process, known as osteopenia when mild and osteoporosis when severe, is a natural part of aging, but carries important implications for health and independence. Bone is a living tissue that is constantly being broken down and rebuilt through a process called remodeling. In youth, bone formation outpaces resorption, leading to peak bone mass in the late 20s or early 30s. After that, the balance gradually shifts and bone loss begins to exceed bone gain. For women, this process accelerates after menopause due to the sharp drop in estrogen, a hormone that protects bone. Men also experience bone loss, though typically at a slower rate. By the time someone reaches 80, decades of gradual bone loss can result in bones that are thinner, more porous, and more susceptible to fractures. Even minor falls, such as tripping on a rug or slipping in the bathroom, can lead to serious injuries like hip fractures, wrist breaks, or vertebral compression fractures in the spine. These fractures are not just painful, they can have life-altering consequences. A hip fracture, for example, often requires surgery and prolonged rehabilitation. It can lead to loss of mobility, increased dependence on others, and even a higher risk of mortality in the months following the injury. According to research, up to 20% of older adults die within 1 year of a hip fracture, often due to complications like pneumonia or blood clots. In addition to fracture risk, declining bone density affects posture and height. Many seniors notice that they are not as tall as they once were, sometimes losing an inch or more over time. This shrinkage is often due to compression of the vertebrae in the spine, where weakened bones collapse slightly under the body's weight. This can lead to a stooped posture, known as kyphosis or dowager's hump, which can affect breathing, digestion, and balance. Despite these challenges, it's crucial to emphasize that bone loss does not have to mean a loss of quality of life. With awareness and proactive care, many older adults maintain strong bones and continue to live actively and independently. Nutrition plays a foundational role in bone health. 2 key nutrients are especially important: calcium and vitamin D. Calcium is a primary mineral in bones, and adequate intake helps slow bone loss. Good dietary sources include dairy products, milk, yogurt, cheese, leafy green vegetables, kale, bok choy, fortified plant-based milks, and certain fish like sardines and salmon with bones. Vitamin D is essential because it enables the body to absorb calcium from the gut, while the body can produce vitamin D through sun exposure. Older adults often have reduced skin synthesis and may spend less time outdoors. Therefore, many seniors benefit from vitamin D supplements, especially in winter months or in regions with limited sunlight. In addition to nutrition, physical activity is one of the most effective ways to support bone strength. Weight-bearing exercises, those in which the body works against gravity, stimulate bone formation and help maintain density. These include walking, climbing stairs, dancing, gardening, light resistance training with bands or small weights. Even everyday movements like standing up from a chair or carrying groceries contribute to bone health. The key is consistency. Regular, moderate activity is more beneficial than occasional intense workouts. Take the example of Robert, an 84-year-old retiree, who began noticing that he felt less steady on his feet. His doctor recommended a bone density scan, which revealed mild osteoporosis. Instead of accepting this as inevitable, Robert committed to a daily routine that included a 20-minute walk, gentle resistance exercises with hand weights while watching TV, and a diet rich in calcium and vitamin D. Within months, he reported feeling stronger and more confident. He even joined a senior fitness class at his local community center, where he made new friends and stayed motivated. His story illustrates that it's never too late to take action. Fall prevention is another critical aspect of protecting bone health. Simple home modifications, such as installing grab bars in the bathroom, removing loose rugs, improving lighting, and using non-slip mats, can dramatically reduce the risk of accidents. Balanced training through activities like Tai Chi or yoga also enhances stability and coordination. Medications are available for those with more advanced bone loss, including bisphosphonates, hormone therapy, and newer biologic agents. These should be discussed with a healthcare provider, as they come with potential side effects and are not appropriate for everyone. Above all, maintaining bone health after 80 is about empowerment. It's about making small, sustainable choices that add up over time. It's about recognizing that while the body changes, it still responds to care, movement, and nourishment. And it's about preserving the freedom to move, explore, and engage with life, not just survive, but thrive. 3. Digestive function shifts, nourishment, comfort, and connection. As individuals enter their 9th decade, the digestive system undergoes a series of subtle but significant changes that affect how food is processed, absorbed, and utilized. While these shifts are a normal part of aging, they can impact energy levels, nutritional status, and overall comfort if not properly understood and managed. The digestive tract, a complex system stretching from the mouth to rectum, relies on coordinated muscle movements, enzyme production, and a healthy balance of gut bacteria. With age, several components of the system begin to slow down or become less efficient. One of the most notable changes is a reduction in stomach acid production, a condition known as hypochlorhydria. Stomach acid, primarily hydrochloric acid, plays a crucial role in breaking down proteins, activating digestive enzymes, and killing harmful bacteria. When acid levels decline, food may not be digested as thoroughly, leading to bloating, gas, and a feeling of fullness after meals. This reduced acidity also affects the absorption of certain nutrients, particularly vitamin B12, which requires stomach acid and a protein called intrinsic factor to be absorbed in the small intestine. Vitamin B12 is essential for nerve function, red blood cell production, and cognitive health. Deficiency can lead to fatigue, memory problems, and even neurological symptoms. Many older adults benefit from B12 supplementation, either through diet, fortified foods, meat, eggs, or injection/sublingual tablets if absorption is severely impaired. Another change is a slowing of gastrointestinal motility, the movement of food through the intestines. The muscles of the digestive tract weaken with age, and nerve signals that coordinate peristalsis, the wave-like contractions that push food forward, may become less efficient. This can result in slower digestion, increased risk of constipation, and discomfort after eating. Fiber becomes especially important at this stage. Soluble and insoluble fiber help regulate bowel movements, feed beneficial gut bacteria, and support heart and metabolic health. However, many seniors consume less fiber due to dental issues, difficulty chewing, or preference for softer, processed foods. Encouraging the inclusion of cooked vegetables, whole grains, fruits, legumes, and psyllium husks can make a meaningful difference. Appetite also tends to decrease with age, a phenomenon known as anorexia of aging. This is not a psychological disorder, but physiological shift influenced by changes in hunger hormones like ghrelin and leptin, reduced sense of taste and smell, and slower gastric emptying. Some older adults simply feel full faster or lose interest in food altogether. Consider the experience of Thomas, an 82-year-old widower who once enjoyed large, hearty meals. After his wife passed away, he found himself eating less and losing weight unintentionally. He realized that the rich, fatty foods he used to love now made him feel sluggish and bloated. With guidance from a nutritionist, he began eating smaller, more frequent meals, oatmeal with fruit in the morning, a vegetable soup at lunch, a smoothie in the afternoon, and a light dinner of grilled fish and steamed vegetables. He also started taking a daily walk after meals, which helped stimulate digestion and gave him a sense of routine. Over time, his energy improved, and he even began experimenting with new recipes, finding joy in cooking again. Hydration is another critical factor. The body's thirst mechanism becomes less sensitive with age, so older adults may not feel thirsty even when dehydrated. Chronic dehydration can worsen constipation, impair kidney function, and contribute to confusion or dizziness. Encouraging regular sipping of water, herbal teas, broths, and water-rich fruits like melons and oranges can help maintain fluid balance. Beyond the physical, digestion is deeply tied to emotion and connection. Meals are often social events, times to gather with family, share stories, and feel loved. When digestive discomfort or appetite changes interfere with eating, it can lead to isolation or sadness. Therefore, supporting digestive health is not just about nutrition. It's about preserving joy, dignity, and human connection. Simple strategies include eating in a calm, distraction-free environment, chewing food thoroughly, avoiding large meals late at night, incorporating probiotic-rich foods like yogurt or kefir, using herbs and spices to enhance flavor for those with diminished taste. By approaching digestion with mindfulness and care, older adults can continue to enjoy food as a source of pleasure, nourishment, and belonging. 4. Changes in bone and joint strength, mobility, flexibility, and daily function. As individuals progress into their 80s and beyond, one of the most impactful physical changes involves the musculoskeletal system, particularly the bones and joints. While bone density loss was discussed earlier, joint health and overall mobility deserve a deeper, more focused exploration, as they directly influence independence, safety, and quality of life. Joined to the points where two or more bones meet, allowing for movement and flexibility. They are cushioned by cartilage, a smooth, rubbery tissue that reduces friction and absorbs shock. Over decades of use, this cartilage naturally wears down, a process accelerated by factors such as genetics, previous injuries, repetitive strain, and inflammation. By the age of 80, many people experience some degree of osteoarthritis, the most common form of arthritis, characterized by joint pain, stiffness, swelling, and reduced range of motion. Commonly affected joints include the knees, hips, hands, spine, and shoulders. A simple act like rising from a chair, climbing stairs, gripping a jar, or walking across a room can become more difficult. Tasks that were once effortless may now require more time, effort, or assistance. For example, an 85-year-old woman who once spent hours gardening may now find that kneeling or bending causes sharp knee pain. Similarly, a man in his early 80s might struggle to lift his arms to retrieve a book from a high shelf due to shoulder stiffness. These limitations can be emotionally challenging. Mobility is closely tied to identity and autonomy. When movement becomes restricted, it can lead to feelings of frustration, helplessness, or even depression. However, countless older adults demonstrate that while the body changes, the spirit of independence does not have to diminish. Adaptation, rather than resignation, becomes the key. Take the story of Eleanor, an 87-year-old retired nurse who loved tending to her flower beds. When arthritis in her knees made kneeling unbearable, she didn't give up gardening. She reimagined it. She built raised garden beds at waist height, allowing her to work comfortably while standing. She invested in lightweight, ergonomic tools with padded handles, reducing strain on her hands. She scheduled her gardening for mornings when her joints felt least stiff and took frequent breaks to stretch. Eleanor's approach reflects a powerful truth. Aging doesn't have to mean giving up what you love. It often means finding new ways to continue doing it. This mindset shift, from limitation to innovation, is one of the greatest strengths of later life. Maintaining joint health after 80 involves a combination of movement, nutrition, and environmental support. Contrary to the outdated belief that rest is best for sore joints, gentle, regular movement is actually one of the most effective treatments for joint pain and stiffness. Exercise increases blood flow to the joints, nourishes cartilage, strengthens the surrounding muscles, and improves flexibility. Low-impact activities are ideal for older adults. These include walking, a simple, accessible form of cardiovascular and joint-friendly exercise; swimming or water aerobics. The buoyancy of water reduces stress on joints while providing resistance for muscle strengthening. Tai Chi, a gentle martial art that combines slow, flowing movements with balanced training and mindfulness. Yoga, modified poses can improve flexibility, posture, and joint awareness. Cycling, stationary or recumbent bikes offer a safe way to maintain leg strength without impact. Strength training is equally important. Muscles act as shock absorbers and stabilizers for joints. When muscles weaken, a condition known as sarcopenia, which accelerates after 75, joints bear more pressure, increasing the risk of pain and injury. Light resistance exercises using bands, small weights, or even body weight, like seated leg lifts or wall push-ups, can preserve muscle mass and support joint function. Nutrition also plays a role. Anti-inflammatory foods, such as fatty fish rich in omega-3 fatty acids, salmon, mackerel, nuts, berries, leafy greens, and olive oil, can help reduce joint inflammation. Supplements like glucosamine and chondroitin are commonly used, though research on their effectiveness is mixed. Always consult a healthcare provider before starting any supplement regimen. Pain management is another essential component. Chronic joint pain should not be accepted as just part of getting old. Options include over-the-counter pain relievers, used cautiously and under medical supervision; topical creams or patches with menthol, capsaicin, or NSAIDs; physical therapy for personalized exercise programs; assistive devices like canes, walkers, or shoe inserts; in some cases, corticosteroid injections or joint replacement surgery. Environmental modifications can further support mobility. Installing grab bars in showers, using raised toilet seats, adding non-slip flooring, and ensuring clear pathways throughout the home reduce fall risk and make daily activities easier. Occupational therapists can assess a person's living space and recommend practical adaptations. Perhaps most importantly, maintaining joint health is not just about physical comfort. It's about preserving dignity, connection, and the ability to participate in life. When an older adult can walk to the park, play with a grandchild, or attend a family dinner without pain, they are not just surviving, they are thriving. 5. Slower digestive function, rhythm, regulation, and renewal. While digestive changes were introduced earlier, it's worth expanding on the topic of slower digestive function, as it encompasses more than just nutrient absorption. It touches on energy, mood, social engagement, and overall vitality. After 80, the entire digestive process tends to slow down. This includes reduced production of digestive enzymes, such as amylase, lipase, and protease; weaker contractions of the intestinal muscles, peristalsis; decreased blood flow to the digestive organs; changes in gut microbiota, the trillions of bacteria that live in the intestines and support digestion, immunity, and even mental health. The result is a digestive system that processes food more slowly, leading to common issues such as bloating, gas, indigestion, and constipation. These symptoms are not trivial. They can significantly affect comfort, appetite, and willingness to eat. Constipation, in particular, is a widespread concern among seniors. Defined as having fewer than 3 bowel movements per week, it can be caused by low fiber intake, dehydration, lack of physical activity, certain medications, such as opioids, antacids with calcium or antidepressants, and neurological changes that affect bowel control. Chronic constipation can lead to complications like hemorrhoids, fecal impaction, or even bowel obstruction in severe cases. It can also contribute to fatigue, irritability, and loss of appetite, creating a cycle of poor nutrition and declining health. The good news is that most cases of age-related constipation are manageable with lifestyle adjustments. Key strategies include increasing fiber intake gradually to avoid gas and bloating. Aim for 25 to 30 grams per day from sources like oats, lentils, apples, pears, and cooked vegetables. Drinking plenty of fluids, at least 6 to 8 cups of water daily, unless contraindicated by medical conditions like heart failure. Engaging in daily physical activity, even light walking, which stimulates intestinal movement. Establishing a routine for bowel movements, ideally after meals when a gastrocolic reflex, a natural signal to defecate, is strongest. Using stool softeners or mild laxatives under medical guidance if needed. Another important consideration is medication management. Many older adults take multiple medications, some of which can interfere with digestion. A thorough review with a doctor or pharmacist can identify drugs that may be contributing to gastrointestinal issues and explore alternatives when possible. The emotional dimension of digestion should not be overlooked. Eating is one of life's greatest pleasures, a source of comfort, celebration, and connection. When digestive discomfort makes meals unpleasant, it can lead to social withdrawal. An older adult may decline invitations to dinner, fearing bloating or needing to use the bathroom frequently. Yet, many discover new joys in this stage. Lighter meals, soups, stews, smoothies, steamed vegetables, can be easy to digest and still deeply satisfying. Exploring new cuisines, cooking with grandchildren, or joining a senior meal program can restore the social and emotional benefits of eating. Consider James, an 82-year-old widower who used to eat large, heavy dinners. After experiencing frequent indigestion, he worked with a dietitian to redesign his meals. He began eating smaller portions more frequently, focusing on warm, cooked foods that were gentle on his stomach. He discovered a love for miso soup, congee, and vegetable broths, foods that were nourishing, easy to digest, and comforting. He also started attending a weekly lunch group at his local senior center. Not only did he enjoy the food, but he looked forward to the conversation and camaraderie. His digestive symptoms improved, and so did his mood. This illustrates a profound truth. Aging invites a redefinition of nourishment. It's not just about calories or nutrients. It's about care, connection, and the rhythm of daily life. When digestion is supported with patience and intention, it becomes a pathway to well-being, not a source of frustration. Final reflections. Embracing the gift of longevity. Reaching 80 and beyond is not merely surviving. It is a profound act of living. It is a testament to the resilience of the human body and spirit. While the physical changes are real and sometimes challenging, they do not define the experience of aging. Instead, they invite a deeper relationship with the self, one rooted in awareness, adaptation, and grace. The 5 shifts discussed in sleep, bone density, digestion, joint strength, and metabolic function are not signs of failure, but signals from the body asking for attention, care, and respect. They remind us that aging is not a disease to be cured, but a natural phase of life to be honored. With knowledge comes power. By understanding these changes, individuals and their families can make informed choices about diet, exercise, medical care, and lifestyle. They can create environments that support independence, reduce risk, and enhance comfort. But beyond the physical, aging at 80 and beyond is also a spiritual and emotional journey. It is a time for reflection, gratitude, and legacy. Many older adults report a deep sense of peace, wisdom, and appreciation for simple pleasures, a sunrise, a shared laugh, a warm cup of tea. Society often undervalues older age, equating it with decline, but those who live it know differently. This stage of life offers unique gifts: the freedom to prioritize what matters, the clarity that comes with experience, and the opportunity to mentor, inspire, and connect across generations. To anyone watching, caring for a loved one, or approaching the stage themselves, know that aging is not about losing youth. It is about gaining depth. It is about learning to move with the body's rhythms, to listen to its whispers before they become shouts, and to treat with the kindness that has carried you through a lifetime. Small choices matter. A daily walk, a calcium-rich meal, a moment of mindfulness before sleep. These are not just health habits. They are acts of love. As we conclude, let us reframe the narrative of aging. Let us see it not as a descent, but as a transformation, one that deserves dignity, support, and celebration. Thank you for engaging with this journey. If this guide has resonated with you, please share your thoughts. What have you learned? How do you plan to apply this knowledge? Your voice matters. And remember, every stage of life is worthy of care. Every chapter deserves to be lived fully.